I can really recommend being a foster carer for Notts County Council. There's always someone walking the journey alongside you, whether that's other foster carers or social workers. It really helps to provide stability and consistency for children who really need it, and that's really rewarding as a foster carer.
Roger and I have been fostering for 35 years. We do deal with challenges, but to say we've been doing it for 35 years to me proves that it's not impossible. We learn an awful lot from these young people, and even now we're still learning.
As a foster family, we care, we want to make a difference, and we get so much fulfilment from fostering. The satisfaction of making a difference is something that money can't buy. Just seeing the smiles on the children's faces and helping them reach their potential is wonderful.
We work as family workers within the fostering service for Nottinghamshire County Council.
I really enjoy my work. I really enjoy meeting lots of different foster carers.
You know, we get to know the families, we get to know the kids, and we care basically. It's important as it is to them that the kids are getting the support that they need.
A lot of people said to me they would like to be a foster carer, but there's something stopping them. I had that as well. And we decided just to jump in and do it and see what happened. And for us, it's been the best decision we've ever made.
It's been a fantastic decision, it really has, yes.
Once people start to become a foster carer and take that leap to do it, they'll understand how much it gives back, not just to the child, but how much it empowers you as well.
I'm Leon, I'm a care leaver, and I've been in care since I was 8. And I've been with the same parents since, and they're amazing. Like, they are my foster parents, but I do class them as my parents, my mum and dad. All a child wants really from a family is to be supported, loved and cared for, and know they're there because they're wanted. From personal experience, I know the difference it's made for my life.
We always say that we foster as a whole family. It's not just us who are the carers, our children are involved in that. And even now, people express concern about the effect on our birth children of foster caring. I think we need to kind of get past that and dispel that myth, because actually the overall effect on our children, I think, is positive. They're learning new skills, they're gaining empathy, they're interacting with children from different backgrounds. For a long time we didn't make use of support care, and we wanted our child to settle into our placement and not feel pushed out, but it's actually been really helpful for us to start to have support care.
We've known Zoe for a number of years, and it's meant that we got to know her foster child. So for her it's been like coming for a sleepover rather than a feeling she's coming to another family. I got into fostering for Notts County Council, and it was something that I've always wanted to do. But working full time and my husband also working full time, we thought it's not really going to be something we can do now. But after looking at the website, we realised there was this wonderful thing called support care that we were able to offer. It might surprise you, but actually I'm under 30, I don't have any children of my own, and that doesn't stop you from being a foster carer.
I think some people don't go into foster care because they think it's going to be really costly to have another child living in their house, but actually the fostering allowance is generous enough to cover all the costs of having a child living with you.
We have a lot of fun on the weekends when we have foster children in. We get to go to parks, ice skating, children's events, trampoline in parks like I Jump.
We get access to the Max card, which is a discount card for foster carers and their children to access different local amenities. Also recently we went on holiday and we were able to use the Max card to get free access to some castles and historical places because it's a national initiative.
We chose to go with Notts County Council because of the support care that was offered and the training. And it's always local to Nottinghamshire. My parents are foster carers for an agency, and they found it really difficult to get support care for their child.
My name's Lynn. I am now a support foster carer. We were mainstream carers, but given our ages, we felt that we couldn't commit to children for long term anymore. We just find it really rewarding, the relationships we build up with these young people, and we feel we're perhaps a bit like grandparents to them. With the children coming here for weekends, this enables their mainstream carers to have a break, and this makes things more secure perhaps for the children to continue there. I work with my supervising social worker to sort out the dates. She comes out to see us every month, and it's all very relaxed. I find Robin really easy to speak to. She listens to my concerns, and I value what she is saying to me in return.
The benefits of a supervising social worker are always having someone to contact. There is also emergency duty team that they can contact on a weekend and out of hours. I think the times that it gets difficult is when, you know, she supported a child for a long time and then they're either moving on out of area or they're moving on because they've reached the age of 18, you know, and she has to say goodbye to that child, so that can be always emotionally draining. Generally it's staying in touch so they know that you do care about them and you are concerned, you know, that the impact that something like that has had on them.
You do feel fully supported. It's like working in a team. We still even now go on training sessions. I almost look forward to those sessions because you meet other foster carers there and it's very interesting. I've always fostered with my husband, who's brilliant, and I feel personally I couldn't do it without him. He's super with the kids, and it's just something we continue to enjoy doing. A lot of our friends feel at the ages we are, we shouldn't be doing it, but it's a way of life for us now.
I'm Mark, I'm foster care dad in the family. I'm the fun dad, if you like. I've tried to be anyway, try to be.
And I'm Amy, a foster carer. So we have 4 children of our own and then we foster younger children into our family. Being a foster carer is a devastating privilege. It's devastating that children have to be in this situation, and yet what a privilege that we are able to help them.
Yeah.
When you foster as a family. I think it's very important that everybody in your house is involved. And even though we have 4 children of our own, we don't find that a challenge, we find that quite an easy thing to do. Daniel particularly, he's older and he sees more and he understands more because he's older, and he feels that it's given him an insight as to when he's older and he has his own children. Whenever a placement ends, we always ask them, do you want to do it again? Would you like another child? And it's always yes. And even though we've had the sadness maybe of a child leaving, and they are sad when a child leaves, the positive that we get out of it, they get to see, as we do, the happiness when a child leaves us, and that inspires them as well to want to do it again and again and again, as well as us.
When a child leaves, it's sad for us, but it's happy for them.
The biggest thing for us has been the support network, because if it wasn't for them, I don't think we would be able to carry on. I think it's a big, big thing to know that there's always someone there if you've ever got problems. And for our children, they really enjoy the events that we attend. We've been quite surprised at actually the amount of events there are.
Barbecues and picnics and
local supports
and Foster's Got Talent. We've been to the Christmas do's and the Sons and Daughters events here today are fantastic for our children. They really enjoy it, and I think it's a lovely thing for them to do.
And it's very empowering for them to know that they're appreciated as a child in a foster family.
We are allocated to new foster carers so that we can give them support and advice before they get their new placement. So we might go out and give them some advice around therapeutic parenting and kind of build up their foster carer toolkit before they begin.
Yeah, and we've got an idea of obviously the child who's being placed with them, so that we can tell them some background about that particular child.
We find that children that have experienced trauma or have attachment needs are more responsive to therapeutic parenting than your average parenting. So that's very much what we encourage our foster carers to do.
Theraplay is obviously a form of therapeutic parenting. A lot of the foster children, their early life experiences of being quite sad, really. They haven't had any compliments. Nobody's ever said that they've got nice eyes. Nobody's said that the hair's nice. So that is something that we always start off to build their self-esteem.
Yeah, there's lots of nurturing activities, so tactile, skin to skin contact, eye contact. We'll offer nurture in positive ways, introduce it slowly, so we might do touch with a feather, maybe feather face painting.
One of the main purposes of therapy is for them to achieve, so we always want them to do really well. And we adapt the games depending on the age and the abilities of the children. When I go out and visit foster parents and explain what therapeutic parenting is, it's as if a light bulb just turns on in the head.
I think because we visit regularly, we go back and get the chance to go over what we talked about last week and see if they've tried it out and if it worked, and like you said, that you've had that light bulb, oh, I tried what you said and you know what, it worked.
I'm Gemma and this is my husband Paul, and we're both foster carers. I think initially we were a little bit anxious ourselves about going to panel. It sounded quite scary, but it wasn't at all. It was just a really friendly chit chat with a group of people around a table. It was more of a celebration really of us being there and of us, wanting to become foster carers. The County Council offer a fair rate of pay, so we get paid dependent on our level of experience. So after you've done it for a while, then your level of pay will go up based on your experience and level of training that you've done. We've also got a network hub, which is a foster carer support group, and it's just an informal get-together. We feel so valued as a foster carer for Nottinghamshire County Council. Everyone's so caring and wants what's best for you as a family. The matching process is really careful, so they listen to our needs, and they would never think of placing a child that wouldn't fit in our environment. As a foster family, we try and just make it everyday normal life, try and bring some stability and love to that child that's staying with us, and give them experiences that perhaps they've not experienced before. We love going out on day trips together, and for example today we've come pony trekking. Nottinghamshire's a great place to foster because we've got so much on our doorstep, there's so much that we can do. I feel really lucky that we're able to foster here.
I'm Leon, I'm a care leaver. I went into care when I was 8 for reasons of basically not being looked after properly. So I've been in care for 15 years, long time. I was very, very nervous to start with, very quiet. I used to be very, very withdrawn. My foster parents encouraged me to go to my friend's dance group. It made me a better person, I think, and it's made me realise what I can do. Without my foster carers and the fostering service, they've made my life go a completely different way of what it would be if I wasn't in care. For my next plans I've got, which is hopefully moving to Beijing to teach English and teach dance and train over there and just travel, they're so supportive. When I told them about it, they said go for it. My parents said that there's always going to be a room if I need to come back for a little bit or if I come back to visit. I class them as my real parents because they've just, everything they've done for me. There's a lot of children out there who need a second chance at life or just need that extra support that if their parents can't give them. Anyone can do it, and if you feel like you want to but you're unsure, as far as I can say, I'd say give it a go, because from personal experience I know the difference it's made for my life.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/stay well. Children up to Year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
COVID-19 is in our communities and the number of cases is on the rise. So it's essential that we each play our part in full by following all of the government guidance. Only by doing this can we keep our schools and businesses open. If you're young and healthy, you may feel the virus isn't a threat to you. But someone more vulnerable to coronavirus than you, perhaps someone closer to you than you realise, is depending on you to play your part in breaking the chain of transmission. So I'm asking everyone to do their bit. Stick to the rule of 6 for gatherings indoors or outdoors. Wash your hands thoroughly and regularly. Wear a face covering in enclosed spaces. Observe social distancing of 2 metres or 1 metre plus precautions where 2 metres really isn't possible. Follow all of the guidelines about car sharing. If you have symptoms, self-isolate and get a free test immediately. If we work together on this, we can control the spread of the virus. Thank you.
My name's Jonathan Gribbin. I'm the Director of Public Health for Nottinghamshire County, and I'd like to tell you about the COVID-19 Local Outbreak Control Plan for Nottinghamshire. It's all about containing the virus so that we can protect one another, safeguard our critical services, and enable our schools, our workplaces, our communities to flourish again. And the plan describes how we will do that in Nottinghamshire. It complements the national test and trace arrangements, and it builds on local arrangements with key partners like Public Health England, the district and borough councils, the city council and our local NHS. It identifies a range of settings such as schools, workplaces, universities, care homes and so on, which require
Good afternoon, everybody. I'm just going to kick off the meeting on behalf of the Chairman of the Committee. Councillor Lawton is with us this afternoon, and we'd just like to welcome all viewers to this virtual meeting of the Governance and Ethics Committee, which is being held remotely, being broadcast live, and it's being recorded for publication as well. For the benefits of the viewers of the live stream, I'm now just going to read through the list of the members who are present on the call and also officers who are joining the meeting as well. So in terms of the councillors, we do have Councillor Bruce Lawton, the chairman of the committee. We also have Councillor Brooks, Councillor Carr, Councillor Fall, Councillor Handley, Councillor Henry, Councillor Madden, Councillor Phil Rostance, Councillor Sissons, Councillor Walker and Councillor Wright. As well as myself, the following officers are also present today. We have Marjorie Toward, who is the Service Director, Customers, Governance and Employees, Nigel Stevenson, the Service Director, Finance, Infrastructure and Improvement, Heather Dickinson, the Group Manager, Legal and Democratic Services, Rob Disney, Group Manager, Assurance, Phil Dent, Audit Team Leader, Joe Kirkby, Team Manager, Complaints, Ainsley MacDonald, the Service Director, Living Well Community Services, Colin Pettigrew, who is the Corporate Director, Children and Families, and Jenny Sumner, who is a business partner in Customer Services. Thank you, Chair. It's over to you for the first item of business, which is the minutes of the last meeting.
Right, thank you very much. The minutes of the last meeting, can I take those as the true records? All those in favour, thank you. As part and parcel of, I won't be asking the clerk of the meeting to read everybody's name out on a vote. We just ask for all those in favour to just put your hands up, and if there are any people who are against or abstain, then please notify by pressing the hand on your toolbar. Okay, so can I take the minutes of the last meeting as a true record? Thank you. Anybody? Yeah, everybody happy? Thank you very much.
Sorry,
right,
sorry, Chair. Sorry, Chair. Councillor Fall does have a hand raised at the moment.
Yes, sorry.
I was just going to say, sorry, Chair. I'm all right.
Just
to apologise to Keith. You wanted to know why I wasn't present at the last meeting, and I was on my holidays. I think Liz Plant subbed for me, didn't you? Just to clarify that. No problem apart from that. Thanks.
John, you've got your hand raised. You're quiet at the moment. You're mute. Just press him.
I said I'm abstaining because I wasn't present at the meeting. Okay.
You got that, Keith?
Yes, I've got that. Thank you.
Okay, right. Apologies for absence. Are there any, Keith?
Sorry, Chair. In terms of apologies for absence, we have an apology from Councillor Kevin Rostance, and Councillor Andy Sissons is substituting for him.
Okay, welcome. So we'll go straight on to declarations of interest by members and officers. Are there any? No. The agenda item 4, the local government and social care ombudsman decisions. Joe, the floor is yours.
Okay. Hello, everyone. First of all, I'd like to acknowledge there's quite a hefty annex to this item, and the reason for that is because for two reasons really. During the early period of the COVID pandemic, the committee didn't meet so often, and also the Ombudsman ceased working for a period, both in terms of accepting new complaints and contacting the council with decisions. So what you have here is a period that covers February to September decisions by the local government Ombudsman. The Ombudsman, just for clarification, is now working normally, so we're back up to dealing with them in the normal way now. So what you have is 20 decisions that the Ombudsman made in that period. In 6 cases, they didn't pursue the complaint, although they reached a decision. They didn't do an investigation. That was either because they were subject to legal proceedings, matters dealt with in court, or that there was insufficient evidence that fault would be found by the council. So there were full investigations in 14 cases, 1-4, and in 6 of those cases, 6 of those investigations, no fault was found. So out of the 20, there were 12 cases where either there was not sufficient evidence of fault, a legal reason why we couldn't go ahead, or there was no fault found. You've got at Appendix A, the cases summarised for you for ease of reference. The first 6 are the 6 that weren't proceeded with, and then the others are the full investigations. So those full investigations, 3 related to adult social care and health, where fault was found, 4 related to children and families, and 1 actually related to the forestry team. So the following paragraphs really just highlight the narrative of some of those complaints. I'm happy to go through that for you, but It's there in the report and summarised in the appendix, and it may be appropriate to ask me questions or direct them to the senior managers from the department. Just before I do that, I've got one update which is on page 13 of your of the appendix, where it says there's a fee waiver. When I wrote the report, I didn't know how much money was involved in that. It was still being calculated, but I can confirm to you that the fee waiver was £255.91.
Thank you, Jo. We will take the fact that members have read the papers.
Yeah.
Thank
you, Chair.
We do have two service directors on place. We've got Colin and Ainsley. Do you want to come in, Colin, and talk about your area of responsibility, and then Ainsley? Is that how you want to play it?
Chair, I'm happy to do that if that's.
Well, it may head off. It may head off questions as we go through. If you make a presentation on behalf of your particular department. Okay. You go first, then, Colin.
Okay. Thank you, Chair. And as just to delve further into Joe's data, there were 5 investigations with regards to children. One was found to be no fault following the investigation. A 4th one was actually with regards to the management of the complaints process, and then the 3 substantive complaints that were investigated and fault found. Were one with regards to the payment of special guardianship allowance. So that's when usually a kinship carer, a grandparent or a relative or someone that's well known to the child, looks after the child rather than the child becoming looked after. It's 3. That fault was coming up to 4 years old, 3.5 years old now, and was in a previous incarnation where we paid different rates to special guardians than we did to our foster carers. We found that during that investigation, the case law had established that that was not acceptable, and we should be supporting special guardians in the same way financially as we do foster carers, including birthday and festivity allowances. So during the investigation, we made that recompense, and then subsequently, the Ombudsman agreed that there was fault there. But at that point, we had already remedied the fault with a financial recompense and apology to the special guardians. The second in Appendix A is with regards to not being able to find the provision that was outlined in the EHC plan for a period of 6 months, which was too long. So the whole of the autumn term and the spring term, up until Easter, March 2019. With regards to a child with special educational needs and additional needs, and we were found fault, and we've made the recompense as required by the Ombudsman to that child and their family, and to his father, for our failure to consider him as a carer and do a carer's assessment. And then the final complaint that is there is with regards to, again, education, health and care plan, and committee will know that that whole area of special educational needs does attract some level of complexity, but also some level of, a not insignificant level of complaint. In this case, we accepted that fault was found in our delay with regards to the provision, and we have paid as per the Ombudsman. And it's important, I think, that where fault's found, that we make the remedy as quickly as possible and make the apology to you, which we've done. I'll pause there, Chair. I'm happy to take any questions, unless you wish Ainsley to respond to.
No, we'll finish you first, Colin, if that's all right. Kate, you've got your hand up. Sorry, you just is it to Colin you want to ask a question?
I was going to ask some general questions across the board, so I don't mind. Do you want me to do it now, or do you want me to wait?
Well, no, we'll Steve, who did you want to ask a question of?
just a general comment, so I'll wait to the end.
Right. Okay. Well, so I mean, from the chair, Colin, really, one of our major interests is that you have changed process to make sure that it doesn't happen again. Whilst we are interested in reparation, we are more interested in the change in process. So as long as you can assure the committee that you have put in place managerial changes not to allow it to happen again, then we are, you know, sort of more than happy, so to speak.
So, Chair, just to assure you, and if I do that by one illustration, the first case where we hadn't calculated the special guardianship, not only did we recalculate that for that carer, but we've done that for all special guardians as well. That obviously will add to the council's bill, yeah, for children in those settings. Yeah, but we've made, and again, because that's 3.5 years old, that's been covered in subsequent budget rounds.
Thank you very much. Okay, so Ainsley, the floor is yours.
Yeah, thank you, Chair. So in relation to the adult cases, for the ones where fault was found, the first one at paragraph 8, in terms of our lack of monitoring of a provider agency quality of support, we have taken that on board, and we have got a robust quality audit tool in place. We did make reparations in this case, but as you quite rightly say, Chair, not only is it about reparation to the individual, but it's important that we take on board the learning from all of these, which we have done through our quality market management team, because even if it's not ourselves providing the support, ultimately the council are responsible for the quality of the delivery of adult social care services being delivered on our behalf. In terms of the second case at paragraph 9, where we reduced the complainant support package, the fault was found that our assessments didn't clearly explain the changes in need or the circumstances that led to that reduction. This is something that we are monitoring quite closely, in terms of making sure that all of our information that we put into assessments and support plans is clear, not just to ourselves, but also the individual and the family to whom it relates. This is something that, you know, we are building into our owning and driving performance programme that we're just about to launch, so that staff really take responsibility for all of the elements of their work, and this is something that, you know, we have seen several times over, where written information is not in a clear format that is easily understood by families. So that is something that we are taking on board. In this case, we did reinstate the original provision, and we did apologise to the individual and family concerned. In terms of the third investigation, where we were found to be at fault, again, this concerned information provided at the beginning of a support home care package and delays in cancelling the package. The fault that was found was that we didn't review it after 6 weeks, which is what should happen. We should review any care package after the first 6 weeks to make sure that it's still appropriate to the individual's needs, which didn't happen, and that might have been the thing that prompted the family to cancel the care package at that point. Charges then accrued, and the recommendation was that half the charges should be waived, which is what we did, and we're currently conducting an audit to determine that 6-week reviews are being undertaken. Slightly more difficult under the current circumstances with COVID, but that is something that must happen, even if it's by virtual means, which is likely to be the case at the moment. Happy to take any specific questions.
So if you and Colin can just stay on until the members have asked their questions, because there may well be things within their question you wish to clarify. Okay, the first one then is Kate.
Thank you, Bruce. Just an observation first. I don't know whether Ainsley would like to comment on this, but it struck me again that the adult social care ones, it does show the impact of the change in policy, where the cuts the contribution to the cost of care were made for adults with a disability, and I think that's very sad. A more general point, although it does relate to one specific thing, and that is, I know Ainsley mentioned that actually staff need to be responsible for kind of the quality of the care across the board, but there is reference there to an agency clearly underperforming, not providing the standard of care that you would hope for. And I just wonder to what extent that's monitored in terms of trends and specific providers, and how that impacts on future commissioning. And thirdly, and it's good to hear Colin say that clearly around the guardianship one that has been resolved, but I wonder, because the Ombudsman report says very clearly this is what was agreed, therefore there I'm going to leave it because this is what's going to happen. What happens if it doesn't happen? Does the Ombudsman come back? I mean, who kind of checks that kind of, that cycle of kind of completeness? I think a final thing as well is, it struck me too, I know there's an awful lot here. I'd like to know why the Ombudsman wasn't hearing complaints. Everybody else was working frontline, weren't they? I'm not quite sure why they weren't. But it strikes me as well, I know there's a significant number, but the percentage where fault was found seems to be very high in this group. And I just wondered if anybody would like to comment on that, if there's a reason why that was. Yeah, that's me done. Thank you.
Okay, thank you. There's 3 questions there, one for you, Ainsley, one for you, Colin, and one for you, Joe, I think. So if you take it in that order, okay? Ainsley first, yeah.
Okay, so in terms of provider monitoring, yes, we do accumulate information about underperformance, and we do have regular visits and quality monitoring visits with providers, and we also get feedback from people who use services. When there are issues that start to accumulate over time, we do log that, and that will escalate the level of our intervention. I guess it's a little bit like the COVID escalation levels and interventions, where we start to get multiple complaints or concerns, or indeed safeguarding referrals that relate to a single provider. That would then escalate the level of intervention that we would take. Now, in this case, clearly, this lady and her family were unhappy with the quality of the care that was being provided. What I don't have in front of me is whether we had multiple complaints about this particular provider, but I can certainly get that information to you if that's of interest. But our normal route would be accumulation would lead to more robust intervention and potentially sanctions such as suspending contracts if necessary.
Okay, right, Colin.
Thank you, Chair. And I think, with respect, Councillor Fall was using the children's complaints to ask a general question. I think Councillor Fall, with regards to what happens if the recommendation by the Ombudsman isn't followed up, what's the control loop? Yeah, I think Joe's probably in the best position. I can see her nodding to answer that before I guess. Yeah, go on, Joe.
Okay, Joe. Okay. You haven't got to comment, Joe, on the on the fact that the Ombudsman went into meltdown.
Well,
that's not really your responsibility.
I can tell you a couple of things. I'll tell you what I understand about that. I think the Ombudsman's main stated aim about not taking stuff was not to add to the burden of local authorities, which they recognised was under a great deal of stress and strain dealing with COVID-19. They also gave local authorities some guidance about what the Ombudsman expected us to do and how it expected us to deal with complaints. So I can't speak for them, but I can say that that's what their published rationale was. In terms of monitoring the remedies and outcomes, Councillor Fall, the Ombudsman comes back to me as the link officer within the council regularly on anything where there has been a remedy or we've undertaken to take certain action and ask us to prove that we've done that. So if it's an apology letter, we provide a copy of the apology. If it's a review of financing or whatever it might be, we provide that, or I will go to my colleagues in other departments to ask them for their evidence if it was a change in policy, for example, or the one that Ainsley referred to was the audit being conducted about the reviews after 6 weeks. So I know who's got the lead on that, and I will be asking them for an update about what that's shown. So they come back very regularly on all those cases, and we have to demonstrate what we've done. I hope that helps.
Thanks, Steve.
Yes, thank you, Chair. Just really, I think it's something I've raised before, that what we have here is the results of inquiries or investigations undertaken by the Ombudsman. But of course, we all know that the number of cases that go as far as the Ombudsman compared to the number of complaints that we receive are very small. So it would be helpful from time to time if we saw the underlying complaints data, whereby we can actually identify trends that we as councillors might not necessarily be aware about. See, some of the things that are worrying me here is there a, and I don't think this for 1 minute, but it's worth considering, is there possibly a training issue with some people, or are people overworked, which is another issue, which as councillors we should all be considering. And I agree with Councillor Fold that there are some worrying things here, but also from a service background before I retired as a bank manager, I also am aware that some people just don't complain because they don't think it's worth it, because they don't think anything will get done, and that does worry me in general. But so it would be really, really useful if we could see some figures with regards to complaints that don't go to the Ombudsman.
Joe?
Do you want me to respond to that, Chair?
Yeah.
We can provide that to Committee, Councillor Carr. It would be a very officer-intensive thing to do that every time this committee met, just because of preparing the reports to do that. But certainly one option might be to do that every 6 months. And I would invite the committee to consider whether or not they want to carry on having the regular Ombudsman things every month, or have the Ombudsman information as part of the wider context of the complaint landscape, if you like, within the council. But that may be something that the committee would like to consider, or perhaps would like me to talk to the chair about outside of this and come back with a proposal. I'm not sure, Chair, how you'd want to deal with that.
I think that would mean quite a considerable amount of workload for Joe's department. Steve, I'm with you. Understand exactly what you're trying to achieve. I think we need to make sure that we don't overload that department as well as others within the council. So can you bear with me on that one, and we'll have a chat, and I'll have a chat with, and we'll see what we can. I agree with you. You know, this is only the surface. The underlying information would be of use to us to be able to understand what's going on. But it's how we present that, and
I don't think we need
how we get that information.
I don't think we'd need it every committee. Council Lawton. I think the idea that we do it once every 6 months together with the Ombudsman data might be worth investigating.
Okay. Yeah, we'll have a look at that one, but that would mean, Joe, changing some process, would it not?
It would, and perhaps you know, if we give that commitment to work towards that, perhaps we could have a discussion and bring something back to the next committee about what we propose to do.
I think that would be,
if you think that would be helpful.
Are you happy with that, Kate? You're happy with that? Yeah, good. Okay, we'll move forward on that one. I've got Nikki with her hand up. Nikki Brooks.
Thank you, Chair. All I wanted to comment on was it's the page 69 of the yellow pages, 83 of 170. It's with regards to a decision that I'm really pleased to see where the council was found at fault for failing to consider a request to trim back a council-owned tree. I know this, in the great scheme of things, seems odd, but I've had a lot of these complaints from people who've said, I'm not expecting the council to do the work, but either they're overhanging my property or the light to my property is being damaged. I'll pay. You can oversee the works, make sure you're happy with it. And the council has said no, and I found that really hard to defend. So I was really glad to see this this ruling on this one, and I hope it's going to lead to a change. That's all I want to say. Thank you.
Okay, thank you very much. Thank you very much, Ainsley and Colin and Joe. That's very useful. And we'll have a look at that one. We'll deal with it through the managerial process. Is that okay?
Yeah, thank you, Chair.
Okay, thank you very much, guys. Right, so the recommendation. Can I say from the chair that irrespective of what Steve has said, it is still very useful for the committee to receive these ombudsman reports. And also to really look to see whether there's any trends, and also to get the officers in front of us to tell us what they've done about it. Really, I would be more worried if they were coming here and saying, "Oh well, we need to work something out to be able to how we're going to operate in this particular area." Most times they've come with already having not solved the problem, but looked at the problem and put in place managerial changes. Okay, the recommendation is on page 9 and 10. Sorry, 3 and 4, or 9 and 10 of the whole pack. Are we quite happy with that recommendation? All those, just put your hands up, please, so Keith can see you. Okay, there's no objections or abstentions. Got that, Keith?
Yes, that's
great. Okay, we'll go straight then. So that is, sorry, seconder? Andy?
Yes, I'll second it, Chairman.
Okay, we'll go straight on to assurance mapping. I think this is you, isn't it, Rob?
Yes, thank you, Chairman. Yeah, this report was delayed due to the pandemic. It wasn't, or didn't prove practicable really for us to gather the information during that period. It's the second year of the assurance mapping process. It retains the 3 areas that were covered in the first year, so that's finance, risk and performance management. And then this time it adds in 2 new areas, people and assets management. The report sets out just a reminder of what the aim of this process is, and essentially that's to try to bring together a view of assurance that's available from the 3 lines of defence for the aspects of governance that are in the map. And the assurance is brought through around those key lines of inquiry that are set out for each of the areas that are in there. And then we try to arrive at an overall assurance level for those areas. So the appendix sets out all of that evidence that's been collected across the 3 lines this year. And then the report summarises the headlines from each of those lines. And I think you'll see it's mostly positive assurance that's been reported. Undoubtedly, the process brings out some of the significant challenges that the council's facing at the moment in those governance areas. But I think the assurance that comes through is that the council's response to those challenges is positive and continues to be developed in some areas. The report then also just includes a reminder of the benefits of the assurance mapping approach and how it's being used currently and how it could be used further still. So that's in there as well. The The report's gone through, has been shared with the corporate leadership team. It's been positively received and endorsed by that team. So on that basis, Chairman, it's proposed to retain the process for the current year, keeping the existing 5 areas now that are in it, but then expanding it further again for the current year into 3 more areas. Those are set out: transformation, commissioning and procurement, and information governance. So I'd happily take any questions, Chairman. Thank you.
Yes, Kate.
Yeah, thank you, Bruce. This is, to be honest, this is such a massive report. I know in the past we've gone, because there's been so much detail, and now it's been reduced and very cleverly presented. But I have to admit that it is still quite difficult to kind of grasp and understand properly with somebody who's not a technical background. But I'm not criticising you, Rob, because I know you're doing your real best on this one. So it's difficult stuff to get across to poor folk like me. So I'm just going to pick on just one thing that just jumped out at me a little bit, and that is the people management one. I just wondered, and I understand from people who sit on other committees that actually there's been some positive feedback in terms of staff motivation. But I wonder only because I've been involved in doing some staff surveys in schools, and we've asked very specific questions about how safe they feel and how they think the COVID things are going, and you do tend to get a different response. And I just wondered if, in terms of staff motivation, if those COVID specific safety questions have been asked, and if so, what the response was.
That's a process that's on the go at the moment. There's, I think Marge might. I can see Marge has just manoeuvred and come in. So do you want to take that one, Marge?
Yeah, so we did a staff survey and asked those COVID-related questions because for the reasons you're articulating, and we have got plans to follow, and we've used that to shape some of our planning about how we're going and what we're going to do in respect of staffing matters. What we are going to do, though, is follow that up now in the autumn. Probably not do a survey in perhaps quite the same way, but we'll follow it up with some focus groups where we can delve a bit into the detail a bit more, and some webinars. We're planning to start them at the end of this month with the chief executive and with the corporate leadership team, so we can ask people a bit more detail, because obviously in a survey of its very nature, if you're surveying 7,500 staff, it tends to be quite high level. We got actually a very, very positive response, very high number of staff responded in a very positive response. But COVID has gone on a long time now, hasn't it? So we want to go back and ask people some more detailed questions and see what things they would value for us to have in place now going forward for the foreseeable future, because it looks like it's here to stay.
Are you okay with that, Kate? Steve?
Just wanted to say I like the way this is presented. I found it very easy to understand, and pleased that there are actually no adverse negative findings on the things that we've presented with. So yeah, I like this format. Thank you.
You're going to have your doors widened to get through them, Rob.
Thank you, Chairman.
Well done. Yeah, no, assurance mapping is something that we brought in as a committee, and we followed it through, and we're expanding it. It's working. I always remember one particular member of staff coming up to me and saying, "I'm having to audit myself. How am I going to manage that?" You know what I mean? And that was what we have achieved, and they're more than happy to do it. It's part and parcel of their everyday working lives. So, any other comments? No? Okay, so we agree the recommendation. Do I have a seconder, please, for recommendation on page 11?
I'll second it, Chairman. Thank you.
Okay, thank you very much. All those in favour? Thank you very much. That's unanimous, Keith. Okay, we'll then go straight on to the quarterly governance update. Rob, you're on again.
Thank you, Chairman. Yeah, the latest update on governance issues and actions. This comes from the annual governance statement, and the aim with this one is to really try to keep that annual governance statement live and up to date throughout the year. So we're trying to use the statement as a document that's going to drive governance actions on an ongoing basis, and not just an annual exercise to comply with statutory requirements. So we try to do that in two respects through this report. Firstly, around the update on the significant governance issues that the council's facing, to keep that refreshed during the year, and that gives us a chance to check back in quarterly with our local code of corporate governance in considering that, and that's the code that comes through to you at the end of the year to this committee. You'll see that the updated list that's presented in this report, that's a list that's been refreshed through the corporate leadership team, and that really, I think, it's just identified one that it might now be time to think about removing, and that's the one around the return of the committee schedule. So members' views on that would be welcome on this report. And then the second way in which we try to keep the annual governance statement live through this report is around the action plan, of course, that comes out of the annual governance statement. That's set out in the appendix. You'll see that we're probably quite early stages of the year for some of the actions in there, but there are lots of progress to report as well, and you'll see that some things have been ticked off already as completed. So again, Chairman, happy to take any questions on that one. Thank you.
Steve?
Yeah, thank you, Chair. Page 120, page 3 of the report, Brexit implications for the Council. The last sentence, the Council's risk assessment is being updated to ensure appropriate mitigations are planned for the scenario that trade negotiations are not completed in this timescale. Can you give us some sort of ideas of what risks are being mitigated?
Yes, typically those are things. I think a key one for us to focus on is around the supply chain. So whether there are any implications for us in respect of that. Another one that stands out is around the supply of labour as well, and whether we have any vulnerabilities around the labour market. Finance as well is a key one, and what the impact of that might be on our already challenging financial situation. And so it goes through. I think there are around sort of about 14 or 15 type risks that are in there, and we've been updating that recently. We update it almost every time that something happens with Brexit. So there was quite a period where there was not a great deal happened on it since the vote. It was put into place soon after the vote happened, but then we've been going back to it and updating it continuously once there was another development, and that's something that we've just done again just recently this week, or just completed it this week. So yeah, that will carry on right the way through as things go on.
Happy, Steve? Okay, Kate?
Yeah, thanks, Bruce. A couple of things. I think the thing that jumped out at me, as you may imagine, is the local government reorganisation issue. And I wonder where we are with that, especially given now it seems it's not going to go ahead. And an awful lot of both officer time and money has gone into it. So that might not be a question for Rob, I'm not too sure, but clearly it's a significant issue that needs responding to. The other one is around transformation operating. Be really interested to know how far that's got, because I know that Derek's been poorly, and I understand there that there's an issue in terms of having to recruit somebody to that post. Just how far that is actually managing to get. I think that's it. Thank you.
You want to comment on both those, or just one, or how do you want to play that, Rob?
I was just looking to see whether Nigel or Marge wanted to come in on either of them, but I mean, I can chip in what my thoughts are. Yeah. Well, on the LGR side of things, I think on that, you know, from the officer side at least, sort of a clear request to press on with that and prepare, update the case for that, and that's what's happening at the moment. So there's a team in place that's doing that and taking that forward. And you know, I guess that will be the case until such time as a different decision's taken on that. And then in relation to transformation, I think again, as you said, there's some processes going on there around the structure, and we're looking at the transformation model. And again, there's a corporate recovery and transformation group at the officer level, which is taking all of that forward, taking the the learning that came out from working with the external partner, Newton Europe, and then thinking where we go next, really. So that, and I think there's been recent reports gone through to the Improvement and Change Subcommittee, setting all of that out, and what the focus is going forward. That's my
okay. From my point of view, from the chair, what the report shows us as a committee is that Rob and the team are fleet of foot. They are responding to issues which are arriving on their doorstep very regularly and quickly. And I think from our point of view as a Governance and Ethics Committee, part of our responsibility as governance, we need to ensure that the people who are governing Nottinghamshire County Council are responding accordingly to the changes which are occurring very rapidly out there in the economic environment particularly. Okay, everybody happy with that? Yeah, do I have a seconder to the recommendation then, please?
I'll second it, Chairman.
Thank you very much. All those in favour of the recommendation, which is on page 5, everybody happy? Yeah, got that?
Yes, got that, Chair. Thank you.
Okay, we'll go then straight on to Rob, which is your final report, the internal audit recommendations.
Thank you, Chairman. I'll just point out I'm joined by my colleague Phil Dent on this one, who's the audit supervisor in the team. Phil might well be able to help out with any questions on the detail in this report. This is again a delayed one to allow for the focus on the COVID-19 response, and I think that's reflected quite strongly in the update this time around. There's a lot of detail that's included there, but I think it's quite common to see that progress with some of the actions has been hampered by coronavirus, and I think that was to be expected. And as a consequence of that is that the charts do this time show more red, probably than members have been used to seeing in this report in the previous updates that have come through. It's not to say, though, that there's been no progress. You'll see in the appendix that there are quite a few in there that have been marked green to indicate that they've been fully implemented. And so those will be ones that we'll be able to remove for the next update in 6 months' time. But I think the position is generally there is some catching up to be done. So I think it will remain an important area of focus for the committee to help drive through the agreed actions that have been signed up to in order to ensure strong and effective governance, because of course that's what the broad focus is of all of those actions. I think it's clear from the course of the pandemic, as my reflection really, that the council will need to continually update its keep its priorities up to date as we go through the next phase. And I think probably something that internal audit might be able to do here is to perhaps go back to these actions and review them in the context of a continuing and probably fluctuating response from the council over the next period. Particularly, I'm thinking in the area of social care. So we might be able to go back and think, well, which of those remain a high priority throughout that scenario? The ones that probably leap out at me are the ones around the actions to prevent and detect fraud, because I think that will be an important area to keep a focus on. It's the big we've seen during the pandemic in the first phase. There's been vulnerabilities around fraud on that. And then maybe ones that might move down the ranking, maybe some of those that are concerned more with implementing some of the specific actions that came out of the procurement audit that are in there. So they may be things that we could perhaps stand that they could be put back as a lower priority. So I think that's something that internal audit can probably help with, and members' views on that will be welcome either now or over the coming days. So again, I'm happy to take any questions and comments, Chairman, and Phil. I'll ask Phil to chip in as well if there are any points of detail. Thank you.
Phil, is there anything you want to add to that?
No, not really. I've gone through all of these reports with each of the senior auditors, and I'm actually quite buoyed up with the fact that all these areas are being actively tracked. The delays are for the reasons mentioned. Some particularly priority 1 recommendations, it takes a long time to address the fact that, for example, there hasn't been competitive tendering, or a contract is being annually renewed beyond its period of of that being sensible. So some things take a long time anyway, and of course COVID has particularly affected commissioning and contracting and tendering. But I'm satisfied that we're holding departments to account, and that they are giving good reasons for where they've got to, and good reasons where there is delay. Thank you.
Thank you, and welcome to the committee, Phil.
Thank you.
Right, Steve.
Yeah, just very quickly again, I'm not at all surprised to see the results on here. I mean, let's face it, it's not just Nottinghamshire, all the districts and boroughs as well have gone from the situation of most people working in the office to a situation where most people are working at home. So it's always going to be difficult to do audit under the old regime in that circumstance. And if this thing goes on any further, then we're going to have to adapt, aren't we? But I'm sure we've got that in hand. So again, I'm not surprised at the results here.
Okay, I don't think that requires a comment actually from the pair of you. It's just a real, it's just your oversight of the actual papers, Steve. And I agree with you. Kate?
Thank you, Bruce. Yeah, thank you. It's good report. Thank you, and for the work that's gone into it. It's clearly a great deal. I just wanted to ask a question. I wasn't sure where else to bring it up, but it might be even in the work programme. But a while back, I asked if we could do an internal audit on the way the council conducts public consultation, and I don't see it anywhere. I don't think that's necessarily a question for Rob. I think that might be a question for Marjorie. I'm not too sure, but I haven't seen it anywhere since, and I wonder if it had been forgotten.
Rob?
I can make sure that gets in the reckoning for our next termly plan. As you know, we refresh the plan every term, so I can put that through and see how that sits alongside other priorities, and if it, or at least make it obvious what the result of that risk assessment has been, and whether I'm proposing that it is something that we have a look at, or reasons why for the next term it doesn't rank as a priority in my view. So I can do that for the next termly plan, which will be coming through from December. Okay.
Yeah. Phil, the only bit, well, there's quite a bit within this report that's not. It isn't worrying, but it has been highlighted. But one of the real ones that that does worry me is the KPIs. If we haven't got the KPIs coming through, we're not going to be in a position to be able to assess any difficulties of which the council is going to be may arrive at in the future. I'm just wondering, are you happy with that, or are you with the fact that they are being delayed, or are you pushing the departments to push them through?
No, I think it would be. I'm not happy in the sense that I'm never happy. So where there are big splodges of red in pie charts, that is unsettling. What I am happy about is that the auditors are making active efforts to keep these issues front and centre, in front of action owners, and where action owners are having to take longer in implementing, that there are genuine reasons for that. There is a situation where an audit that is, for example, 3 years old, if there are still actions to be implemented, then I think it's time for another audit. A good example of this would be, for example, in adult social care and health direct payments, where there's always a risk. Obviously, service users receive a lot of money, and there's always a risk where they're not accounting for the way they're spending their money, and we're trying to devise escalation procedures, and there is still some delay in implementing. Often there are system improvements, but what we need to do really is test it in depth, and I think we need to revisit some of these areas. That will be one of them, but there will be others, procurement and so on areas.
Okay, thank you very much. Anybody else?
Thank you.
Do I have a seconder?
Second it, Chairman.
Okay, do we do the recommendation on page 8? Everybody indicates. Thank you very much. And from the chair, thank you very much to the team for all the work you're putting in, guys.
Thank you.
Thank you, Councillor. Thank you.
Right, independent review and oversight into local audit and transparency in local authority financing and reporting. Nigel.
Thank you, Chairman. I think I win the prize for the longest title for an item on today's agenda. And I'll shorten it by saying basically this report is to update members on the outcome of the Redmond review, which is a lot easier to say. The review was commissioned by the then Secretary of State for Housing, Communities and Local Government, the Right Honourable James Brokenshire MP, in June last year, and was centred on the framework for conducting local authority external audits, which followed the introduction of the Local Audit and Accountability Act in 2014. The report provides the link to the full review, as well as setting out the key findings and recommendations from the review. It is important to remember that this review looked at the national picture and makes no reference to any council that does or does not show the best or worst practice. If you were to ask me, Chairman, the key recommendations I would point to, it would be the creation of one body for full responsibility for external audit, improving the current fragmented approach, which is a hark back to the Audit Commission. The recognition that the quality of external audit has fallen and therefore the threat that the cost of external audit would increase, but this should only be justified if quality were to demonstrably to improve. The requirement for an independent member on each authority audit committee, and a further attempt by the setters of local government to simplify the accounts. And I've forgotten how many times this has been attempted and failed. The government, having commissioned the review, will then need to consider and respond to its recommendations, and any changes to the framework would then lead to future consultation before any implementation. Thank you, Chairman. Comments to the report?
I mean, from the chair, Nigel, which is obviously against the views of the leader, I would be the first person to welcome an independent individual onto the Governance and Ethics Committee. I think there is a case for that, but at this present point in time, that is not possible. But in the future, we may well look at that as a way forward. You know, we do have independent individuals on the standards committee, and I think it's good for lay people to see how the council operates and how hard really people work and the amount of effort that's put in. So I think it's nothing to be frightened of.
Yeah, you're right, Chairman, and an awful lot of authorities down the country already have an independent member who's qualified on their relevant audit committees, as they're referred to. And since the statement of accounts are so complex, I can understand members requiring some sort of independent assurance through having a qualified independent member.
Yeah. Kate? You're muted, Kate.
Okay. Yeah, just to say I agree with that. Absolutely.
Yeah. So anyway, but we are where we are, and after May we'll see how it pans out, how the system works. So that is an ideal opportunity to look into possible changes. Okay, do I have a seconder, please, for recommendation on page 3?
I'll second it, Chairman.
Okay, all those in favour, members, thank you very much. You got that, Keith?
Yes, I've got that, Chair, thank you.
Okay, so we'll go on to agenda item 9, which is Heather.
Yes, good afternoon, everybody. Thanks very much. So last but not least, we've got something here for you, for members. This report is basically bringing you an update on the progress with regard to the programme for members' communication and engagement. Last time this came to you was December, and paragraph 4 sets out the progress that's been made since then. So you can see that some actions have been completed and others, so like the newsroom and the My Nots app, they have been completed and rolled out, and obviously you're able to use them. Others are still in the development phases. And I think has been mentioned by other colleagues previously this afternoon, inevitably there has been some delay that's been linked to COVID, whilst most of the teams working on this have had their focus on those obviously important matters. So the focus of today's report is really to look at the improvements that we're suggesting for the intranet pages for members. And we're going to show you a brief demonstration of the test pages which have been put together by colleagues in the Customer Services Centre, and they've been working collaboratively with colleagues in Democratic Services. So as the report says, we're proposing to call the new landing pages the Members Hub. And on the call today, we've got Jenny Sumner. She's from the Customer Services Centre, and she's going to share her screen, and her team have been working on the technical side of this, developing the test area. She'll share a screen so that members can actually see the content in more detail as we go through, and you can provide feedback as we go through the demonstration, if that's all right.
Yeah, that's good.
Yeah, is that okay?
Yeah, that's fine. It's remiss of me. Away you go.
Thanks
Can I
very
just
much.
say it's very small? Could you make it bigger for old people like me?
There is a limit, I think, when you're sharing screens to how big it can be. But so
I can read that, Jenny. Yeah, go for it.
is that all right? So I'm going to try and do the talking, and Jenny will sort of try and track what I'm saying as we go through. And the idea is that once you've given us some feedback as we go through, you've looked at the current concept that we're developing, we're talking about maybe setting up a members working group to get into a bit more detail on it, which would be helpful to us as officers. So we're starting by looking at what there is currently. So as you can see, they're in quite an old-fashioned style where you come onto this page for information for counsellors, and you start with a long list of things that may or may not be of interest to you, and then it isn't until you scroll down that you get perhaps some of the stuff that might be more helpful for you, and some of that content doesn't actually link into things that are there's proper content there below. So part of the process and the idea that we've got with the Members Hub is that you get a single access point to the content which may be found currently in various disparate places that you have to maybe hunt for to get what you're looking for. So we're trying to bring it together for you and ensure that it links then into maintained content that is already there. So we're trying to make sure it's an efficient use of what we've got, not trying to reinvent the wheel or create lots of additional content that then has an officer impact in terms of constantly trying to keep on top of it. So if we jump from where we've been into the new look Members Hub, the first thing you can see in the top right hand corner there is that we've styled the page with the members, with the Nottinghamshire coat of arms or crest. And just for a little bit of history on that, it was granted in 1937, and it reflects the county's connections with agriculture, with mining, royalty, and with Newcastle, apparently, Dukes of Portland and Newcastle. And the county is also shown by a green field, blue and white tresses representing the River Trent and the Major Oak. And the motto, Sapienta Proficiens, means progress with wisdom. So there's your little history lesson. I'll move on now. So beneath the header, there's currently 6 tiles that we've got. They each link to some content. We've kept the content to 6 tiles at the moment because we are developing it, so it's pending your input, but also because it's not advisable to have too many tiles on the page, because then you lose content as that's down the bottom. And also when it's accessed through smartphones, apparently the tiles stack up. So Jenny's going to try and show you that now. They stack on top of each other. So again, you'd have a long way to scroll down if we had 20 tiles or something. So the advice is to keep it pithy and as focused as possible. So then we'll go back to the format before, and we'll go through each tile in turn. So the first one you'll see is the council diary. You're all familiar with that. And it just clicks in there to the link for the council diary, and you can access the meeting. So if you wanted to view a meeting, you can just click through in that way. Next up, we're looking at the newsroom. So that's media information, and that clicks into, as I say, the existing maintained content for news information and the latest stories from the council's communications team. The final tile on that top row is the YouTube link, and that enables you to go directly into a live stream if you wanted to look at today's meeting, for instance. So we thought that would be helpful, and it would be an easy way for you to find the content that perhaps you look for when you're wanting to view a meeting that you're not actually a member on yourself. The next one, given what an important topic is for all of the councillors and your constituents, we wanted to provide a dedicated tile through to the highway information. So that goes directly into this hub all about highways, and it's all the normal stuff that you can get through the internet, but it's there in one place for you on your members hub. The next one we've... Oh, sorry, yeah, absolutely.
It was just to say that the Highways Hub is what's currently on the public website. It allows people to view all of the different faults and problems with the highways that they can report. Each one of these, when you click them, then takes you to the relevant form so that they can report a pothole or report a faulty streetlight. So it actually allows users to go ahead and submit a report themselves.
Thanks, that's really helpful. So presumably if you were with a constituent, you could get it on your smartphone, click into the highways tab, and then it'll take you into the pothole bit, and you could just type it in there on behalf of a constituent if they weren't able to do it for themselves. Thanks, Jenny. So moving on to the next tile, we've got the code of conduct there. And that links into the code and all of its supporting protocols. So it's the code's the first bit, and then there's all the supporting protocols about use of resources, etc. So we thought that would be helpful, easy to find for members. And then the last tile we've got on the test site, and I'll emphasize it's a work in progress, it's a starting point, it's not the finished article. So this is learning and development, and that enables you to go in under your own unique login to the learning and development portal, which Jenny's just showing here. So we're logging in on a test basis, and that has a number of different areas that you can click into on it. Again, content needs to be developed for some of this, but so for instance you can click into training and development, and if we scroll down there you could look at evolving as a leader, for instance. So you can click into that, and what comes up is a blank screen at the moment.
There we go.
So yeah, so here it just enables you to come into content which you can freely just browse yourselves and decide, well, I'd like a few more tips about what type of leader I am. So there's a button on that, and it clicks into a short video or a short script of information that you can just top tips on what type of leader you are or what type of leadership style you have. So there's all sorts of content there that you can just browse through on your own. Our hope is that under some of the other buttons that we've got in the training development portal, you can actually we'll get some bespoke content for members. But that needs to be developed yet. So it'll be a sort of combination of online sort of courses and development, and then we're hoping to be able to capture also bookings for events that you might be attending, and then within that it would keep you a record of what you've done. So we thought that would be helpful. So they're the 6 main tiles, and finally above that we've included a feedback link, so that enables you to click in there, and if there's something that's not working you can let us know, or if the content's not what you expected, you can tell us about it. Or you might think, well, there's something, a whole sort of section that we think is missing. You could suggest some additional content, and then what we're thinking is that periodically we'd collate those suggestions for additional content and then look at how, you know, have a dialogue with you about what that would involve and how we might be able to implement it, because obviously every development has an impact in terms of officer time and the resources to actually make those changes in the system. So that's the short demonstration of the sort of test area that we've developed. The next steps for the programme as a whole are to bring you a further report to a future meeting, giving you an update on progress overall. And the next one will probably try and have a particular focus on training and development. So tell you a bit more about what further plans we've been developing for you as members. And then obviously earlier on I mentioned that we'd like to set up a member working group to consider the hub in a bit more detail, to act as a sounding board, and also to act as a touchstone for any of the other elements of the programme that might need more detailed member input than is possible, obviously, in the constraints of a committee meeting. The recommendations are on page 4, and essentially they're to approve the overall direction, to provide any feedback, and to establish cross-party member working group. So I'd just like to thank Jenny and all her team for everything they've done on it, and we're happy to take questions and comments. Thank you.
Thank you very much for that, Jenny. That's excellent. Do you want to comment any further?
No, I think Heather's covered everything. Thank you.
Okay, that's fine. So the first thing is to set up a members working group, as is normally the case, as always been the case. Well, the Vice Chairman normally chairs a working group and he's agreed to do so. So we would need a member from your side, Kate, from, I don't know whether Steve wants to get involved, and we'll just, and Rachel, but I think it's essential that we have a number of members having input on this. From the chair's point of view, one of our responsibilities is to train new members when they come on the council, and this would be one of the portals to be able to do that. The likelihood is we'll still be in a certain degree of difficulty as far as getting faces into people into rooms are concerned for training, and this gives us an ideal opportunity to be able to change the way that we operate. We can put on this particular hub all the training required for councillors, and also have a system in place to be able to ensure that they have accessed it and gone through the relevant training to be as efficient as they can as a councillor. So, Kate, I don't know whether you have thought about the people, a member to help Andy in this quest.
Yeah. I think Errol said he'd be happy to join.
Okay, that's fine.
I've been
Steve?
volunteer chair. Yes, I'll do it. Yeah.
Yeah, well, that's great. Steve, you want to take part?
Steve's left.
Sorry, Chair. Steve's Councillor Carr's left a message saying that he had to leave the meeting. Just
right,
about
well,
5 minutes.
Contact him then, Keith.
Yes, I will do.
Who else you wanted? Do you want another one, Heather? How many?
Well, we were hoping for 3 or 4 people and a good spread across all the groups.
Does anybody else want to volunteer? Oh, it's all gone quiet.
Councillor Wright.
Yeah, Councillor Wright. Martin, we'd welcome you with your views. That would be great.
Thank you.
John, do you fancy having a go? You're muted, John. Perhaps on purpose.
Yeah. No,
well done.
Certainly. Yeah, I was just going to say, I think an excellent idea is to have all the information that you need in one place. I mean, one of the things I find most frustrating, if I want to get hold of a member of a team, their telephone number, it's quite difficult to find. So that would be excellent. So yeah.
Okay, I think you've got a full team now. I don't think any more. Too many would make it unwieldy. Is that all right?
That's fantastic. Thank you.
I've got Errol down as with your hand up. Fire away, Errol. You're muted, Errol.
No, I think that was to talk about the volunteer bids. Sorry, I'll take my hand down.
Any other comments? I think from the chair, I don't know what views are of the committee, but I think this is a great idea. It's important, and Heather is absolutely right, to make it members led, and so we'll see how we get on with it and see how we move forward. Yeah. So you will have a hub that you can be able to access. Sorry about my phone keeps ringing. I apologise. I'll put it on quiet, on silent. You know, it gives you that opportunity to be able to access all the information you need at one location. How good's that?
Thanks very much.
Are you happy with that, Heather? Yeah.
Yes, absolutely. That's great, and we'll get something set up.
Let me just get the relevant page. The recommendation, as Heather has outlined, do I have a seconder?
Seconded, Chairman.
All those in favour? Okay, thank you very much, and thank you to the volunteers. Thank you.
Thank you all.
I look forward to seeing what you come up with, Andy. Okay, so we'll go then straight on to agenda item 10, which is the work programme. Any additions or any comments, please, from anybody? Do I have a seconder to the recommendation? Okay, all those in favour? Thank you very much, everybody, for your attendance. Have a good day. See you later.
Thank you, Chair.
Bye.
Thank you, Chairman.
Bye.
Thank you, Chair. Bye.